About 10 years ago or so, we started doing robotic surgery. And robotic surgery is really an extension of laparoscopic surgery, because in actual fact, robotic surgery is actually not robotic. It depends what you mean by robotic, I guess, but if you think that the robot is going to act and do something, you're going to be thoroughly disappointed. Unfortunately, or fortunately, the robot does nothing by itself. It's not an automated procedure at all. The reason why they call it robotic is because it looks like a robot, I guess, but essentially what it is that those laparoscopic instruments like that we insert and we've been inserting forever in the body, instead of their being controlled by hand, they are controlled by a mechanism attached to a central machine, which is controlled by another machine, which is controlled by the surgeon. And why is that such an amazing thing? The biggest reason why robotic surgery has allowed us to make huge improvements in surgical technique is because of the articulating arms. A robotic surgery allows us to duplicate and scale down the articulating arms of the surgeon, which means, let's say for example, I articulate my arm like this at the wrist, like this. This articulation, okay, which I can perform right here, can be transported and duplicated in the body at areas where I couldn't have possibly, okay, put my wrist because of the tiny scale. So in that regard, in many ways, robotic surgery is like microscopic surgery. So that level of precision and that level of dexterity, okay, was just not possible with open surgery. Because with open surgery, if I have a forceps or a needle driver, I cannot articulate it right at the field, especially if it's a deep pelvic surgery. The only way I can articulate it is right here. But I have my wrist is right here, about 30 centimeters away from the actual site of the incision. The extra dexterity and flexibility has improved our surgical technique tremendously. It allowed us to improve our visualization, decrease blood loss, improve precision, to allow, for example, for a much easier a nerve spare and a robotic prostatectomy, much better visualization of the posterior bladder neck, much improved dissection from the posterior plane of the posterior prostate off of the rectum, much improved visualization and articulation to allow for anastomotic sutures between the bladder neck and the urethra, much better sparing of the urethral stump before the vesicourethral anastomosis in the robotic prostatectomy. So all of these things added up make for an improved surgery and better outcomes. Now, there are surgeons, obviously, who are superior open surgeons that have done it since they were born. And for those surgeons, you'll see outcomes that are just as good as robotic surgeons. But by and large, and on average, from the studies I've seen and from my experience, it is just easier, better, and it's in an open belly, in a closed belly is always easier to recover from as compared to a big open surgery. So that's robotic surgery.